Do you find it more in individuals that have like some type of psychiatric underlying diagnoses, or would you say it just doesn't matter? It happens in everyone.
So there definitely is an increased risk in a person who has another psychiatric condition, particularly mood disorders, anxiety, depression, bipolar disorder. That does increase your risk of developing an eating disorder, but that's not necessary to develop an eating disorder. And so it's, there's so many common underlying triggers that can cause mood disorders and cause eating disorders that a lot of times patients have more than one thing going on, just
Mm,
related to whatever their underlying triggers were.
yeah. I'm curious to find out how you see that impacting intimacy.
Yeah, so intimacy is definitely something that I see hugely impacted in people who are struggling with eating disorders. The most obvious and thing that I think most people can relate to is if you're having difficulty feeling comfortable in your own body and with your body image. Obviously in an intimate situation, your body is very exposed. It's exposed to another person. That can be very challenging when you're already struggling with your relationship with your body to then
Yeah.
have that exposed to someone else.
Sure.
But also, so many people with eating disorders have a trauma history. And that trauma
Mm,
may or may not be sexual abuse, childhood physical abuse. It may be domestic violence. It may be just complicated family dynamics with maybe an alcoholic in the family or someone else with substance use disorder in the family or someone else with an eating disorder in the family. Again, it's very genetic. And all of those sort of trauma triggers that also, as I'm sure you have probably discussed before, that impacts a lot of our self-image and the way that we just function in general. If you're holding trauma and you're holding that anxiety, you're in that fight or flight mode, it's very hard to shift your body into a more relaxed state where you can enjoy and participate in intimacy. So I definitely see that trauma being a huge trigger for a lot of people.